And here is your question. Right, so if you have read and understood, considering it history-taking station, kindly please begin.
Hello, I am Dr. Ali, one of the surgical team. May I confirm your name and age?
Hello, I'm Anne, 54 years old.
Nice to meet you, Mr. Anne. How can I help you today?
I have a back pain.
Okay, I am so sorry. You really looks into pain. Do you have any? Do you need any painkiller?
No, it's okay now.
Okay. Through that, I will ask you some questions. Do you mind?
Yes.
Okay. Could you tell me exactly where is your back pain? It's at the lower of your back or the upper of your back?
Now I feel it like it's a lower side of my back.
When did it start?
I have this pain maybe 5 years ago, but later it became worse.
Okay. Do you remember, did it start gradually or suddenly after any episode?
It was bad. Then I had to lift maybe a heavy object since maybe 2 months. It became so hard for me.
Oh, I am sorry for that. Does this pain refer to any else in your body?
Yeah, sometimes I feel it's in my both legs and my.
Hello?
Yes?
I feel it in my both legs sometimes.
Both legs, okay.
Both legs, okay. Does pain present all the time, or it comes and go with similar activities, very specific activities?
No, actually, when and at rest is not there.
Okay. Does anything trigger this pain?
Yes, maybe when I walk for so long or I carry a heavy object.
Okay. If you were to score this pain for me out of 10, how bad is your pain?
It's maybe 7.
Oh, it's really very, very stressful for you. I am sorry for that. Have you noticed any unintentional weight loss recently?
No,
Any change in your effort or your have you fatigue?
maybe because of the pain. Yes.
Any have you noticed any fever?
No, no.
Did you have any cough, night sweating?
No.
Okay. Have you had recently any trauma to your back?
No.
Okay. Do you have any weakness in your legs?
Yes. Lately I feel some weakness.
Oh, I am sorry for that. Is it present all time or any specific activities?
Maybe when I walk for so long, I get some
And,
weakness.
and this weakness in all your leg or sometimes it's your ankle and or your knee?
Yes, my foot, my ankle, and they are get numb too. I feel like there's numbness in there.
Okay. Have you noticed any change in your water works? Any problems in holding your stool or your urine?
No.
Any numbness in your private area?
No, I didn't.
Nothing like this. Okay. Do you have any other medical conditions?
No, I don't have.
Do you take any regular drugs?
No,
Any history of previous admissions in hospitals?
no, I don't. No, I don't.
Any allergy?
No.
Does anyone of your family have similar condition like this?
No, not as I recall.
What do you do for a living, Mrs. Anne?
I work in a factory.
Oh, it must be hard for you. I am sorry for that. Who do you live with?
I live with my disabled husband.
Okay, I am sorry for that. I think that you have too much going through in your life. It's very. I'm sorry. It's difficult for you. Well, I need to ask you, what's your idea about your complaint?
I don't know. I'm afraid it's something in my back. I'm afraid that the weakness will get increased.
Okay, and what's most thing worries you about this pain?
I'm afraid that I can't work anymore and I can't support my husband.
Okay, it's too early to get to this point. We're here to sort this out together. And what are you hoping from us, Mrs. Anne?
To find a final cure for my pain and my condition.
We will do our best. Now I will ask you some rapid questions, yes or no questions. Do you have any headache recently?
No.
Okay,
Okay,
thank
any
you. Can
shift?
you please summarize your history now?
Today I have spoken to Mrs. Annis, 54-year-old lady presented with back pain, which is gradually gradually in course and started around 5 years ago and increased intensity over the last 3 years. Over the last 2 months, she left heavy objects and the pain get back again to her back. This pain is referred to her both legs as increasing with activities and lifting heavy objects and not relieved only by rest. This pain associated also not associated with any weight loss or any fever. There is no manifestations of cord compression or coda equina. There is no urinary incontinence, stool incontinence, or
Good.
no
So what are
numbness or
your
fever.
provisional and differential diagnosis for her?
Based on the long history and the gradual course of the pain, it looks like mechanical pain, mostly
Yes.
due to disc prolapse or bulge.
And differential diagnosis?
And so we consider also a spinal canal stenosis, also any presence of any malignancy compressing the cord.
All right.
Okay.
Yes. What investigations would you suggest for her?
For that, we should complete our full examination. After that, we
Good.
start with some
Yes.
labs, routine labs and
Yes.
inflammatory markers. We can do X-rays, lateral and EP views, and we can also get MRI
Thank you.
to get the
Quickly
clue.
tell me the management that you can suggest her.
If the patient diagnosed have disc prolapse, we start with very live
First, kindly tell me about the
live
mechanical, because this is your provisional diagnosis. So if the cause is mechanical back pain, so what would be your management?
Yes, first we start with conservative
Yes.
management, lifestyle modifications,
Yes.
and we arrange here social workers to change her work as she's heavy workers, and some exercise to relieve the pain, some activity modification.
Yes.
And after that we can go for some analgesia.
Yes.
If it is not success, we can also consider any cord decompression, micronucleectomy, surgical. Yes. microdepletion.
Okay, if conservative fails, then you can do the surgery.
Yes.
Okay, and the social worker that you need is to relieve her with this work, this heavy work that she's doing. Her
Yes.
husband.
Her husband, yes,
Yes.
and also helping her with her husband.
Yes. Okay, good. Thank you. Right. Thank you.
Okay. Slide